Hello everyone. Today we'll be talking about diffusion problems resulting in hypoxemic hypoxia. So how does a gas diffuse across a surface area? And this follows Fick's law, which tells that the volume of diffusion of gas through surface per minute depends upon your surface area, thickness, and the pressure gradient. In the lungs, this surface area is about 130 meters square in a normal person. Thickness of alveolar capillary membrane is around 0.3 microns, and the pressure gradient depends on the partial pressure of the gas in the capillaries and the alveoli. If you remove the proportionality sign, you get a coefficient which is called diffusion coefficient, and this depends upon the property of surface and the property of gas. Diffusion capacity is defined by the volume of gas going through the surface per minute divided by the pressure gradient. And this is nothing but the diffusion coefficient of gas multiplied by the area and thickness. And this we denote as dL, that means diffusion capacity of the lung for a given gas. In short, you can write this equation as diffusion capacity of gas is the volume of gas that goes per minute divided by the pressure gradient, and in this case P alveoli minus P capillaries, or the vice versa depending on how the gas diffuses. For example, diffusion capacity of oxygen is how much amount of oxygen diffuses in every minute through the membrane divided by the pressure gradient, that is alveolar PO2 minus mean capillary PO2. Carbon monoxide is a very useful gas to measure the diffusion capacity and compare it among various patients. And the reason for this is because mean capillary PCO is 0. And this is because all the carbon monoxide is uptaken by the hemoglobin molecule almost immediately. For the diffusion capacity, carbon monoxide simplifies to how much carbon monoxide is uptaken divided by the alveolar PCO. Both of them are easy to measure. However, in the lungs, the diffusion doesn't have to go through surface, but also has to change media. That is, it has to go from gas to liquid or from liquid to the gas. So this complicates things a little bit. However, the diffusion capacity of gas depends upon the solubility of gas in the liquid media divided by the square root of molecular weight. This table shows the diffusion coefficient of different gases when compared to oxygen, and you can see the carbon dioxide is 20 times more diffusible than oxygen, and this is because it is more water soluble. The other gases like nitric oxide is also higher diffusing capacity because it is more water soluble. However, gases like nitrogen and carbon monoxide, which have lower solubility, have slightly lower diffusion capacity. So in fact, the volume of gas that goes through a membrane depends upon the solubility of gas, molecular weight of the gas, surface area, thickness, and the pressure gradient. So how far does your breath go in when you inhale? You know that the velocity of inhaled gas in a tube is inversely proportional to the fourth power of the radius. So let's look at this question. How far does your breath goes in? You know that the velocity in a tube is inversely proportional to the fourth power of the radius, and as the air moves from trachea to the level of alveoli, the total cross-sectional area increases, and thus the velocity drops pretty fast. And in the last couple of generations of the bronchi, that is at alveolar level, the velocity is almost 0. So the gases here move mostly by diffusion. This diffusion is pretty fast, of the order of less than 10 milliseconds, and this is because the velocity of the air molecules is pretty fast. Just to give you some numbers, the average velocity of oxygen molecule at 37 degrees is around 500 meters per second, and if the alveolar diameter is around 200 microns, that's an average alveolar diameter, the diffusion of gases happens pretty fast. Let's understand what is meant by diffusion capacity of a molecule. For a molecule like oxygen, it has to traverse multiple membranes to reach the hemoglobin molecule and then combine to form oxyhemoglobin. The whole process constitutes the diffusion capacity of the oxygen molecule. It constitutes of two parts. The first part is the diffusion through the membrane, and as you can see, it has to pass through multiple membranes to reach hemoglobin molecule, and this is your diffusion through the membrane part. The second part is the reaction, which comprises of hemoglobin attaching to the oxygen molecule, and this depends upon the rate of reaction and the volume of capillary blood. Even though the oxygen has to go through multiple membranes, realize that the thickness of alveolo-capillary membrane is of the order of 0.3 microns, and it takes pretty short time for oxygen molecule to diffuse through to reach the hemoglobin molecule, but it takes longer for the oxygen to combine with the hemoglobin molecule to form oxyhemoglobin. Thus, we'll see that the changes in membrane does not affect your diffusion capacity by much. So let's look at how oxygen is uptaken along the capillaries. The time taken by a red blood cell to transit capillary is around 0.75 second. Red blood cells equilibrate with the alveolar PO2 in around 0.25 second, that is first 1/3 of the capillary distance. And if the blood gas barrier is severely abnormal, you see that the capillary PO2 does not reaches the alveolar PO2, and thus the blood coming out to the heart is unoxygenated. In this case, the capillary O2 should be 100, but because of the problem with the blood gas barrier, the end capillary PO2 is around 70. So your arterial PO2 depends upon where the capillary PO2 was at the end of 0.75 second. During exercise, RBC time in capillary is shortened, and thus if your blood gas barrier is abnormal, you will reach even a lower oxygenation point in your capillaries, and that will reduce the arterial PO2. The effect of altitude is lowering the partial pressure of oxygen in the alveoli. Let's say your P alveoli is now 50 instead of 100 because you are on the top of a mountain. You can see that the diffusion still happens and it equilibrates in the first 0.25 seconds, just like the previous one. Similarly, as your blood gas barrier gets abnormal, the diffusion gets much slower. In a normal person, the P capillary O2 still reaches the P alveolar O2 within first 1/3 of the RBC time in capillaries. Let's talk about two different concepts, diffusion and perfusion limitation. Let's talk about a gas called nitrous oxide, which diffuses pretty fast through the membrane. Once the nitrous oxide crosses the alveolo-capillary membrane and goes into the blood, it equilibrates there, so further diffusion stops. Unless there is a blood flow to remove these saturated nitrous oxide blood in the capillaries, more nitrous oxide cannot diffuse through. So nitrous oxide is said to be perfusion limited. Another gas called carbon monoxide also diffuses in the same way. However, it is uptaken by the hemoglobin molecule pretty rapidly. Thus the pressure gradient remains constant and you don't need perfusion for the carbon monoxide to enter the blood. So carbon monoxide is diffusion limited. So this is your alveoli, and we talked about beginning of capillary to the end of the capillary, and we take around 0.75 seconds to cross this. These are the alveolar partial pressures, which in a normal circumstances will be around 100 millimeters of mercury. And we know that the nitrous oxide is perfusion limited and carbon monoxide is diffusion limited. This is how the oxygen take looks like. You can see that the oxygen also reaches in equilibrium with the alveolar partial pressure in the first 0.25 second, and unless this oxygen rich blood is moved out of the capillaries, further diffusion cannot take place. So oxygen is a perfusion limited gas. As your alveolo-capillary membrane gets worse, the oxygen takes longer time to diffuse through. And as it gets even worse, you can see that the final P capillary O2 doesn't equilibrates with the alveoli. Now we can see that at really abnormal blood gas barrier, the oxygen can become diffusion limited. This is very simple to correct. As you increase the FiO2, you increase the alveolar partial pressures from 100 to 200. As you increase the pressure gradient, the volume of the gas that is transferred from alveoli to the capillaries will increase, and it will correct the hypoxia. Diffusion limitation rarely causes hypoxemia, as RBCs spend enough time in pulmonary capillaries to allow complete equilibrium. Even in cases of heart failure, where you have got pulmonary edema and your diffusion capacity through the membrane gets worse, the RBCs stay in the capillary for much longer period, and that's enough for the oxygen to diffuse along this membrane and reach the hemoglobin molecule. So let's talk about factors affecting diffusion capacity. The commonest thing that you can think about is thickening of interstitium, either by fibrosis, by fluids, and that can certainly slow down some of the oxygen transport. However, it has to be really extensive before you can see significant hypoxemia. Reduced surface area is, however, a more common cause and is seen in emphysema and pneumonectomy. VQ mismatch is another important cause for reduced diffusion capacity, and it does by reducing the effective area for diffusion. If you have got anemia and reduced concentration of RBCs, you can have slowing down of diffusion capacity. And if you reduce the pulmonary volume, such as happens in pulmonary embolism, the same things will happen. Well, hypoxemia from diffusion issues responds very well to increasing FiO2, as we have seen before. Other thing you can do is you can add PEEP or CPAP to recruit and to increase the surface area for diffusion. However, always look at the risk and benefit of increasing PEEP before doing so. Try to correct severe anemia if hemoglobin is less than 7 and treat the underlying etiology. So in summary, diffusion issues usually cause hypoxemia due to reduced surface area or VQ mismatch, and this can be treated by increasing your FiO2. And you can use PEEP to improve some of the issues if the lungs are recruitable. And to compare the diffusion capacity among patients, we use diffusion capacity of carbon monoxide.